everyone, welcoming you all to the part 2 of Marvels of Menstruation series. Firstly, to begin, I have been asked by many that what made me choose such a title, Marvels of Menstruation. Like, dude, what is so marvelous about menstruation? Like, it always comes in as an unwelcomed guest with a lot of exasperation. I think I'll keep this suspense towards the end of the video, and in the meanwhile, let us begin with today's topic of discussion. So, I am Dr. Marina Babu, consulting homeopath, once again welcoming you all to my channel, Your Health Oasis, your complete healthcare guide. This is a platform where we will be discussing everything about your health issues and concerns. So in our previous video, we have discussed about the physiology of menstruation, puberty, and the HPO axis. Now, what could be our today's topic of discussion? When we have discussed menstruation, how can we not discuss about premenstrual syndrome? Yes, premenstrual syndrome is what we are going to talk about today. So now you must have heard some random comments either about yourself or about your female friend that, oh, she must be PMSing. Now, what is this PMSing? Premenstrual syndrome is the cyclical and recurrent episodes of behavioral, psychological, and physical symptoms that are manifested towards the end of menstrual cycle, to be precise, towards the end of luteal phase. Studies have suggested that 3 out of every 4 menstruating women experience PMS, that is premenstrual syndrome, and it usually lasts for 6 to 7 days and subsides or resolves on its own after the initiation, like 2 to 3 days after the initiation of menses. Now, what are the symptoms of premenstrual syndrome? The symptoms of premenstrual syndrome are primarily divided into behavioral or psychological symptoms and physical symptoms. Let us first go through the behavioral or psychological symptoms. They are stress or increased anxiety, irritability, increased anger, crying spells, depressed mood, loss of interest in interacting with people around, or social withdrawal. All these are the psychological and behavioral symptoms of PMS. Now, even though the pathophysiology of PMS is, still remains unclear, it is more or less related to the hormonal changes that occur during the menstrual cycle. We have taken a sneak peek into the hormones that are primarily involved in regulating the menstrual cycle during our previous video. They are FSH, LH, estrogen, and progesterone. Now, all these behavioral and psychological symptoms are connected to the changing levels of estrogen and progesterone during the entire menstrual cycle. The symptoms of PMS manifest itself basically during the later part of menstrual cycle, to be precise, towards the end of luteal phase. The luteal phase, as we know, lasts from 15th day to the 27th or 28th day in a regular 28-day menstrual cycle. Now, what happens to estrogen and progesterone during the end of luteal phase? There is a steep decline or decrease in the level of estrogen and progesterone. Now, let us keep aside the reproductive system for a moment and focus on the overall effect of estrogen and progesterone on our body. Estrogen plays a major role in mood regulation by increasing the secretion of serotonin and also by increasing the receptors, like serotonin receptors in the brain. Serotonin is a neurochemical that elevates our mood and emotions. It is also called as the happy hormone of our body. Now, the relation of estrogen and serotonin is directly proportional. That is, more estrogen, more serotonin. Less estrogen, less serotonin. And the same is true for progesterone. That is, decreased level of progesterone leads to decreased serotonin levels or decreased serotonin secretion in the body. I hope now all the mystery is unveiled, that towards the end of luteal phase, there is a decrease in estrogen and progesterone levels, which leads to decrease in secretion of serotonin or decreased serotonin levels in the body, and all of this leads to worsening of behavioral and psychological symptoms of PMS, which we have already discussed. Now let us go through the physical symptoms of PMS, which are generalized body ache or abdominal cramps, increased fatigue. Some girls experience insomnia, which means difficulty in sleeping, bloating, increased gassiness, sudden increase in the appetite, swelling, which is particularly seen over the feet or even maybe generalized over the entire body, breast tenderness, also constipation, diarrhea, acne flare-up are some of the other physical symptoms that we notice. How to manage PMS? The frontline management of PMS involves lifestyle modification, that is, eating a healthy and well-balanced diet, exercising regularly, doing yoga, meditation, or adapting any such stress-relieving methods help a lot in managing the PMS symptoms. Also, avoid excessive intake of salt, sugar, caffeine, alcohol, or even refined carbs, especially during the end of menstrual cycle, because that is a time when you are more vulnerable. Get a good quality sleep for at least 7 to 8 hours a day, and avoid staying up late until night. I'm not very much in the favor of taking analgesics or painkiller medications, but you may have to take painkillers if the abdominal cramps or your body ache is unbearable and severe. But make sure that you consult your doctor before taking any such medications. Now, all these lifestyle modification methods will not only help in controlling your PMS symptoms or managing your PMS symptoms, but will also help in enhancing your overall health. Now, there is this entity called as PMDD or premenstrual dysphoric disorder, which is a severe form of PMS where the depression is to such an extent that you have constant thoughts of suicide or suicidal intentions, or the anger is to such an extent that you have the urge to kill somebody. Now, if the symptoms of PMS are so severe that it negatively impacts your day-to-day activities or your interpersonal relationships, you definitely have to seek medical help. That is the high time you have to seek medical help. And even after following all the lifestyle modification and all the stress relieving techniques, well, you're doing it all correct, but still the symptoms exist, you're not feeling any better, that is also the time when you have to talk to your doctor, because we may need to rule out some other pathology. It could be some other disease that you are going through mimicking premenstrual syndrome. So that is all about premenstrual syndrome or PMS. Now coming to revealing the suspense that I was talking about in the beginning of the video, that what led me to choosing this title, Marvels of Menstruation. I strongly believe that our human life is one of the greatest and most spectacular creation of our Almighty God. And we women especially are created more mysteriously because we are given the power to, carry a life within us and give birth to a new life. And menstruation is a part of procreation. And not only one particular system, our entire human life is a marvel in itself. So, and I wanted to keep it more positive and jocular. So that is what led me to choosing this title, like Marvels of Menstruation. So what are you waiting for? Subscribe to the channel, hit the bell icon, and join the family, Your Health Oasis, for more such, great medical content. So until we meet the next time, take care.